I'm pleased to be here with you, and thanks for supporting young Arab rheumatologists. I will talk about this work and is there a difference between ultrasound abnormalities of the heel enthesis according to the disease? So, our heel is widely solicited in our daily life, and its damage is common in rheumatic diseases, whether they are mechanical processes or inflammatory processes. The Achilles tendon and the plantar aponeurosis form the calcaneal enthesis, and ultrasound is a sensitive tool for detecting subclinical enthesitis, even asymptomatic. The aim of our study was to identify and compare the sonographic abnormalities of the calcaneal enthesitis in spondyloarthritis, RI, osteoarthritis, metabolic diseases, and healthy controls. Ultrasound vision can be an abnormalities of thickness of structure, the presence of Doppler signal, calcifications, erosions, retrocalcaneal bursitis. Our study now. Data was obtained for patients from a case control study. It was a blinded prospective study conducted from January to March 2030 at one center. Were included cases of spondyloarthritis, RI, osteoarthritis, metabolic disease, and healthy controls aged between 18 and 50 years. The exclusion criteria are shown on the right of the screen, and the consent was obtained from all participants, but we have not consulted the ethics committees, but we haven't performed any laboratory exams, yes, thank you, exams or radiographs on controls. For the US assessment, we have explored bilaterally PA and AT on a longitudinal and transversal scan by the same sonographer. Patients were positioned in ventral decubitus, feet apart of the examination table with a slight dorsiflexion, after a rest of 20 minutes under 25 degrees temperature. All statistical assessments were conducted using SPSS software. The results now. Let's start with the characteristic of our population. The number of participants was 126, almost women with mean age 35 years and mean BMI 25. 60% of participants was suffering from heel pain, and the anti-inflammatory drug was taken by more than half of the participants. The number of heel examined was 252. No metabolic disease were included in our study. Then we compared the groups. For the characteristic, we noted that between the four groups, they were not comparable, comparing the sex age, the mean age, and the mean BMI, but there was no statistical difference for the presence of heel pain. And also, there was the anti-inflammatory drugs were less taken by the group control. After we have compared the disease group to the control group, the disease group which included spondyloarthritis, RI, and osteoarthritis, and we noted that Achilles tendon and PA was more frequently achieved in the disease group. After we looked for the US elementary lesion, and we noted that there was no significant difference between the two groups considering the presence of bursitis or the Doppler signal. And also for the PA, we have no statistical difference for the presence of an abnormality of thickness or the Doppler signal. After we had compared the three pathologies, and we noted that the PA was more frequently achieved in osteoarthritis. For the Achilles tendon, we noted that calcification was more achieved in more present in osteoarthritis, and that the erosion, bursitis, and the abnormality of thickness and structure, all the other abnormalities was less common in osteoarthritis, and for the Doppler we noted no statistical difference. You will note that for the Doppler we have no statistical difference for between all the groups because of the low sensitivity of our US machine. For the PA, the same. We have the calcification was more frequent in osteoarthritis and no erosion in osteoarthritis. After we have compared the two groups, inflammatory process and mechanical process, and we noted that calcification was more frequent in the mechanical process, and that bursitis and erosion was less frequent in the mechanical process for the axial tendon. For the PA, we noted also that calcification was more frequent in osteoarthritis and no erosion in mechanical process. After that, we have compared the group of spondyloarthritis and RI, and we have not noted that there was no statistical difference between the US elementary lesion for the Achilles tendon and for the PA. So we can conclude that for this intermediate result that there was a difference between the US abnormalities between the disease group and the control group in one hand, and between the inflammatory processes and mechanical process on the other hand, but no difference between spondyloarthritis and RI. The main limitation of our study was the low sensitivity of the Doppler signal of our US machine. So we have to continue this study to have a larger and comparable sample considering the demographic parameters to include more metabolic diseases and verify if the US examination can differentiate between spondyloarthritis and RI. And thank you for your attention.